Good afternoon. My name's Stacy Schleiss, and I'm here to go over how to properly dose a Biote pellet, insert or set up a Biote tray, and then help with the assistance of inserting the pellets. But first, I'm going to start with asking a question. I have Veronica here.
Hello.
As my audience, and I'm going to just start by asking some questions about what would make a good candidate for the Biote pellet. Most patients that come in suffer from certain hormonal imbalances that make them good candidates for the pellets. They suffer from fatigue and memory fog, lack of focus, weight gain, and low libido. And I'm sure most people can relate to that. Bioidentical hormone replacement, it can help all of these things for the better. Bioidentical means that it is bioidentical to the hormones that your body naturally produces already. That just means it's not synthetic, it's not chemically made. It is plant-based, and so it also means that it absorbs more efficiently in your body. You don't have to use creams or no weekly injections. It's a pellet that's placed just under the skin, dissolves over a span of 3 to 6 months, depending on if it's in a male or a female patient. And for my reference here, we have the Biote medical brochure. It has all the symptoms to review about what makes a good candidate for the Biote pellet, as well as what it all will improve once you receive the pellets and your expectations. So there's that. Next, we're going to go over how to appropriately dose and calculate for the pellets. So the first step in figuring out if a patient is a candidate, they come in and do a office consult with the provider, and then they have an extensive hormone panel drawn. It doesn't just check your normal like CBC and CMPs. It goes more in depth. It checks your testosterone level, your thyroid, vitamin D, estrogen, and ferritin, along with some other ones that she uses to calculate other treatment plans, but not necessarily for the pellet. Low testosterone is not the only reason for the symptoms that we're talking about. It's more about one thing. It's about more than one thing. It's about getting the whole picture and optimizing your levels so that you can feel your best. That's the goal here to using the pellets. So once the labs are drawn, we take the information that we have received, and after they've been reviewed by the provider and they discuss it with the patient and determine that it is the best option for them and their health, we input their levels here on the Biote website. They have a pellet calculator that makes it pretty simple. There are certain labs that you have to input. So we're just going to demonstrate here how to do a female pellet. You start with a new patient. And for this purpose, we're just going to make up a fake name. And then over here where it says hormone levels, this is where we're going to start to input the information that we received from their labs. So it's wanting their FSH level, their testosterone level, what form of birth control they're on, their TSH level, their T4 level, and their free T3 level, and then lastly their TPO level. Okay. Okay, and once all of those are inputted, they do ask you some information about the patient's medical history. So they're basically wanting to know if it's a female patient, if they still have their uterus intact. That determines whether they received estrogen with their pellet or only testosterone. So for the sake of this one, we'll say that she still does. And then she has no other symptoms, no acne, no facial hair yet, or anything like that, because this is her first pellet. So then all you do is hit calculate. And it's going to automatically tell you exactly what is needed. Since I used fake numbers, it is going to tell me that it's all 0. I didn't use an actual patient information due to HIPAA regulations. So for the sake of the training, we're just going to guess that she just receives testosterone only. So once you get the pellets, the calculation for the pellets, you'll go and you will get the appropriate dosage for the testosterone. And they come in little vials. They'll have the dose on the front along with the lot number and expiration date. So once you verify that the pellets are not expired, you'll fill out paperwork. This is for the patient and for billing purposes. You put in the patient's information up here at the top. This is just for the cost part. And then down here is where you'll put their diagnosis code and then the dose of whichever pellet they're receiving, testosterone or estrogen, and then the lot number and expiration date. This is all just for documentation and billing. And then after that part, you'll go over all the instructions with the patient. They will have to sign most of these consents. Most of them are just for the insertion of the pellet, the post-op instructions for the pellet, and then just billing information, because these are not billed to insurance. So it's just stating that they're aware that it is self-pay. Once all these forms are filled out, they do receive a copy so that they can take them home if they have any questions. Alright. So from here, we're going to demonstrate how to set up a pellet tray, and then I'm going to have my audience recreate the tray after I show how to properly set that up. Okay, so first I'm going to start with a question before I start this for Veronica. Do you know what the difference is between setting up a female tray and setting up a male tray? What the main difference is?
No.
Okay, so the main difference in a female and a male tray is that a male is going to receive twice as much lidocaine and bicarb to numb the area than female. They will also have a larger trocar device. This example here is for a female. This example here is a female trocar. It's just a small cup. Now for the men, it's a larger tray because they do receive quite a few more pellets. So it's important to focus when you're setting up on your tray. The supplies needed are always correct for the patient. And if you're not sure, it's important to ask questions and double check. We do have examples printed out and laminated that you can see the difference between a female and a male pellet, exactly how it should be set up on the tray if you ever question how you're supposed to do it. So those are available.
Thank you.
So with that, the story I like to say is that the first time I received my pellet, the tray wasn't double checked as accurately as it should have been, and due to my symptoms and my lab results, I should not receive estrogen with my hormone pellet. It should have been testosterone only. So when I received my pellet, it required two testosterone pellets, and the tray was set up and brought in, and the provider placed the pellets, and it wasn't until after the pellets were placed and they were entering the lot numbers and all the documentation into my chart that the nurse noticed that I actually received one testosterone pellet and one estrogen pellet. So at the time, there isn't anything that you can do. Once the pellets are placed, they cannot be removed. They just have to dissolve and run their course. Now, fortunately, nothing happened. I didn't have any symptoms or any complications from the estrogen, and it wasn't a big deal. But in other patients, that could be a large mess up. It could cause them to menstrual bleed again if they've gone through menopause. It could cause a lot of hormone imbalances, and it can affect the testosterone absorption. So that's why it is extremely important to always double check your trays and your pellet dosage and verify your patient information before you start your procedure. Okay, so with that, we're going to walk through how to properly set up a female pellet tray. So first, you're going to take a sterile drape cloth and drape it across the medical tray. And when you're opening up, you're touching the back side of the cloth, so you're not really contaminating the field. Once you get it all unfolded, you just place it on top of the tray like this, so that when you place all your items, they're sterile. And then we start, you try to place things in the order that they're going to be needed during the procedure. So when the procedure starts, the area is sterilized with, well, it depends on the provider, but most providers use 3 of the alcohol wipes to start to clean the area. Then they use the iodine swabs to sterilize the area. And then they will use the lidocaine and the bicarb to numb the injection site for where the pellets are going to go. Once the area is numb, they'll use the small scalpel to make a very small incision. Then once they have done that part and they tell you it's okay to start, you can go ahead and open this. But the preference is to not open this until the procedure has, until the provider is ready, because it needs to stay sterile. Once the provider is ready, they will open the sterile pack of gloves. Up until this point, they just wear normal, non-sterile medical gloves. Once the provider has those on, then you can go ahead and open your pellets, and then you will place those in the cup, which I'll demonstrate when we walk through the procedure. Once the procedure is done, they will clean the area again with steri-strips, rub the steri-strip glue across the top, place steri-strips to close the incision, place a couple of 4x4s on top of the steri-strips, and then seal it with the Tacoderm. So, do your best to just kind of arrange the tray so that everything is kind of in somewhat of order, so you're aware of how to do that. Okay. So, with this, after showing this, I'm going to have Veronica go through and properly set up the same tray, a female tray. And for the sake of sharing supplies, we'll go ahead and just use that. So you did a sterile grate? Mm-hmm. And then you clean. So we have the alcohol pads, the iodine, and then it'll be the numbing. Okay, and then the scalpel, and then the tray where the pellets go in. The sterile gloves, and that's when they start the procedure. And then the cleaning again. The steri strips and the glue, the gauze, and then the Tacoderm. So, got it? Yep. Okay. So that tray is accurate for a female. And like I said before, if it was a male pellet, we would have 2 10mm syringes with the bicarb and lidocaine in it. And we would also have the larger trocar device plus more pellets. That's really the only difference. Everything else is completely the same. Okay, so with that, we're going to go through and demonstrate how to assist the provider with the procedure. Now, due to HIPAA regulations and the personal content of the procedure itself, we're only going to demonstrate how to properly open all of the packages in the order needed as to keep them sterile. I'm not going to actually show how to insert the pellets. Okay, so we'll walk through that now. We'll just use this tray, it's fine. I'm just going to walk through it right here. So what you would normally have is the patient would lay on their side here on the tray, on the table. Feet, they would incline their feet and lay completely flat. A drape would be placed across their waist area, and then the pants are lowered because the pellets are inserted just right here above the buttocks, kind of in your hip area. So once the procedure starts, the provider will start with just regular non-sterile gloves, and so will the assistant. So you'll have 2 sets of these gloves on the tray. Let me just walk through it. So as the assistant, you won't ever change your gloves throughout the procedure. You just need to be careful not to touch anything that needs to stay sterile. So the sterile areas are obviously anything that's coming in contact with the patient's skin. So most providers will tell you how to walk, or tell you exactly what they want and when they want. Most of them start with the 3 alcohol wipes. You will rip them off at the top so that part of them are showing, so the provider is the only one that touches the alcohol pads. She'll use each one to clean the area, or I think she uses 2. Then you will open the betadine packet, which I won't just for supply reasons. There are 3 swabs in there that the provider will take out, swab the area to keep it, to sterilize it. Then she will take one last alcohol swab to clean that off. Once that part is done, you will already have the betadine and lidocaine mixture done. So you will draw up 7 cc's of lidocaine and 3 cc's of bicarb. That is the appropriate mixture for 1 female pellet. So once that is drawn up, they will mark the area with the end of the syringe. Once that's marked, then they will numb the area with the lidocaine and bicarb combination. They'll let it set for just a few, 30 seconds to a minute to make sure the area is completely numb. Then from there you'll open your scalpel. So this one, the area not to touch is at the end. So it does have it where you can open from here, and you will open like this, not to touch it, and hand it to the provider. And all at this time they are still in their blue, just medical non-sterile gloves. Once the incision is made, you will need to open up the 4x4, hand the doctor half, because there will be some blood, so she can use this to keep it from running down the patient's back. She will use those to keep it up. And then once that has stopped, she will open her own sterile gloves and put them on appropriately. And at that time, you will be able to open your trocar kit. I'm going to demonstrate how to do that the sterile way. So again, it has the pull tab here so that you don't touch anything that is going to come into contact with the patient. You will open it like this, and you will only touch the cup unless something falls out, but you can touch the very end. And then the provider will take the tools out with their sterile gloves on and set the cup down in its place. When that is done, you will open the pellets. So for this demonstration, we just picked 2 pellets. So you'll open the lid and then just dump straight to the cup. Don't ever touch the pellets. If one drops on the floor, you can just leave it and go get another pellet. That one can no longer be used. And then you'll dump the second pellet. And then when the procedure is taking place, the provider will use the tools here, which I'll just show you. These are the tweezers used to pick up the pellets. She uses them so that she doesn't touch them. And then this is placed through the incision that was marked on the patient. And then she takes the tweezers, grabs the pellet, places it inside the trocar, and then uses the sheath to insert into the patient, like this. And that's it. She'll do that for the next pellet, put everything back into the cup. She'll grab a couple more 4x4s just to contain any blood. Open up the remaining alcohol pads, clean the area again. Then you will open up the glue for the steri strips. She will swab the area, stick 2 steri strips, put the remaining 4x4 gauze on top of that, and then cover with a Tachoderm. That just needs to stay in place for 24 hours. After that, you can remove it and just put on a regular Band-Aid if they're still oozing. Okay. So, after that, that's like the general setup and dosing a pellet, setting up a tray, and properly assisting in the procedure. Do you have any questions?
What if somebody's allergic to steri strips?
In lieu of steri strips, you can put in 1 to 2 stitches. You will have to come back 3 days later to have them removed. They will not dissolve.
Okay. And then, how long do pellets last for men, like to show improvement, or for women show improvement of?
So for
symptoms?
men, we have them come back in 4 weeks, do another office visit, review their symptoms, and then draw labs to check their levels. If their levels aren't exactly where the provider would like them to be, then she'll give them a booster pellet, which is just usually 1 to 2 more testosterone pellets. And then from there on out, that will be their dose. Same with females, but they come back 6 weeks. That's when their levels will be optimal. They'll come in, do a consult, recheck labs, and if everything is fine, then they don't have to come back until 3 months. So the pellets last 3 to 5 months in females, 5 to 6 months in males.
Okay.
Any other questions?
I don't think so. Thank you.
Okay, so that's it. Thank you so much.